Hi, I'm Dr. Cervantes. If you're watching this video, you or someone you know may have been diagnosed with keratoconus, a condition that's more common than most people realize, but not something most people have heard of. Let's walk through what keratoconus is, how it affects your vision, how we treat it, and what we can do to keep it from getting worse. Let's start with the basics. The cornea is the clear front surface of your eye, like a window. In a healthy eye, the cornea is perfectly round and symmetrical. That round shape helps focus light properly, which allows you to see clearly. Now, if the cornea is shaped more like an oval, longer in one direction than the other, we call that astigmatism. That's very common, and it's usually correctable with regular glasses or contact lenses. We call that regular astigmatism. But if the cornea becomes irregularly shaped, where it's not symmetrical in either direction, maybe it's steeper below, flatter above, or bulging out unevenly, then that's called irregular astigmatism, and that's not correctable with standard glasses. Keratoconus is one of the most common causes of irregular astigmatism. The cornea is made of collagen, a structural protein that keeps it strong, clear, and stable. In keratoconus, the collagen in the cornea is inherently weak. Some people have a genetic predisposition to having weaker corneal collagen, and that weakness can be made worse by things like rubbing your eyes, severe allergies, sleeping on your face, or chronic pressure on the eyes. Just like stretching out pizza dough, the cornea becomes thinner and starts to bulge out, creating an uneven cone-like shape. That distortion causes vision to blur and sometimes worsens over time. There are two main concerns when it comes to keratoconus. First is your vision. How clearly can you see? And second, whether the condition is stable or progressing. In other words, is it getting worse? To manage the vision side of things, we often start with glasses, contact lenses, or specialized contact lenses like rigid gas permeable or scleral lenses. These lenses are often fitted by optometrists who specialize in keratoconus, especially when the condition is moderate or advanced. If glasses or contacts aren't enough, that's when someone like me, a cornea specialist, steps in to consider surgical options. These might include corneal inlays to reshape the cornea, or in severe advanced cases when there's no other option, corneal transplant surgery. In the past, a cornea transplant was the only treatment. Thankfully, we now have ways to help much earlier, often avoiding or delaying the need for transplants altogether. The other big concern with keratoconus is progression. Some patients have stable keratoconus. It's not perfect, but it's not changing. Others have unstable or progressive keratoconus, where the cornea continues to thin and steepen over time, and the vision just gets worse. Younger patients tend to progress faster, and progression can happen at any age. There's only one treatment proven to stop keratoconus from progressing: corneal collagen cross-linking. This is an in-office procedure that strengthens the cornea to stop it from changing. Here's how it works. We numb the eye with drops. We gently remove the surface layer of the cornea. We apply a special drop called riboflavin for about 30 minutes to soak into the cornea. Then we shine a specific wavelength of ultraviolet light onto the eye for another 30 minutes. The light, riboflavin, collagen, and oxygen cause a chemical reaction that forms new bonds, or cross-links, between the collagen fibers, making the cornea stronger. Cross-linking does not make the cornea normal again. It just stops it from getting worse. Most people only need one treatment per eye for lifelong stability. A small number of people may need a repeat treatment, especially if they continue to rub their eyes or sleep face down. We do measurements at 1 month, 3 months, 6 months, 1 year, 18 months, and 2 years to monitor for stability. After the procedure, the eye can feel irritated for a few days. We'll prescribe drops to help it heal, and we see you regularly to watch the eye heal and check to see that the procedure worked. It's common for the cornea to look like it's getting worse in the first month. That's normal and part of the healing process. If you're planning to be fitted for glasses or contact lenses afterward, That can usually happen about a month after cross-linking. As with any procedure, there are risks, including pain, infection, inflammation, scarring, or the rare possibility of progression or needing more surgery. The chances of serious complications are very low, but they're not zero. That's why follow-up is so important, to catch any issues early before they affect your vision. Keratoconus is common, but often underdiagnosed. It can feel scary to hear about it for the first time, but there's a lot we can do. Whether your vision can be improved with lenses or your cornea needs help staying stable, we'll walk through your options together. When we meet, we'll talk about how your vision is affecting your life, whether your keratoconus is stable or progressing, and what steps we can take to protect and improve your sight. Thanks for watching. I look forward to meeting you.